Thank you so much. It is, I think for my students who happen to be here, and I'll embarrass them in just a second, at least four of the nine students I have now, this has been a lecture long time coming. They've heard me talk about bits and pieces of this in class as well. I'll present some actual science and not just spit random facts at you now. And this is sort of like a lecture here. I'm talking to you, but I'm excited to introduce everybody to this concept if you haven't heard. If you're much for social media, there's a good chance that you've heard of the cold plunging, quote unquote, fad that has been happening the past few years. I put quotation marks up because cold plunging is not so much a fad if you talk to anybody from the rest of the world. This is something that has been going on for centuries in forms of cold and hot therapy, and there are a plethora of metabolic and health benefits that do come with this. It's something that I personally have been practicing for some time now, and I never skip the chance if anybody's interested in talking about it. Happy to talk with anybody after this presentation as well. And I happen to talk to a fellow a fellow care provider. She was a nurse on the airplane on the way here after we handled a medical emergency from somebody this morning, but that was a different situation altogether. So cold water immersion, but I hate the cold. I hear that a lot. It's okay, you're not alone. The good news is nobody really likes submerging their body into actual freezing water. It doesn't feel good. It's not comfortable, but in the bad news, it never gets easier. So at least there's that. The benefit here, though, and we'll go into much more, is that it creates a mental fortitude that spills over into many other aspects of your life. And that, to me, is a value that is intangible, but extremely important. So I personally have been cold plunging since the summer of 2022. Started with cold water exposure in the form of cold showers, 30 to 60 seconds at the end of a completely normal shower, and then progressed to cold water immersion. We'll talk more about that in a little bit. So again, because this is the scientific session, I wanted to actually relate this to real peer-reviewed research that does exist, that does show benefits for this therapy. This isn't just kind of a left field situation, although it feels like it a little bit of a Perfusion Conference. Dr. Susanna Soberg is primarily, she's Dutch, or she's not Dutch, sorry. She's Danish. The next gentleman's Dutch. She is Danish. She is one of the world's foremost researchers in cold and hot therapy for metabolic benefit. And I wanted to read this little excerpt from her book, Winter Swimming, that was published in 2019. Phenomenal read, just because it kind of frames what we're talking about here in terms of what's going to happen when you enter, and when all of you try this out for the first time, enter cold water. So when winter swimming, the two factors affecting the body are the cold and the hydrostatic pressure of water. The cardiovascular response experienced by unhabituated winter swimmers on initial immersion of cold water is known as the cold shock response. It's defined as a reflex response driven by the sympathetic system due to the activation of peripheral cold receptors, manifests itself as an inspiratory gasp, that big breath you take, followed by hyperventilation, tachycardia, hypertension. Sounds wonderful, right? The decrease in skin temperature activates cold receptors. The physiological explanation here is that the cold receptors in the skin signal the hypothalamic temperature center in the brain. In other words, they send a message saying, this is really cold. Sorry, that's important because that's exactly what your brain is yelling at you when you get in this water, and why it's so important to approach it from a method to contain this, but we'll get into that in a second. So your brain says, this is super cold. The brain responds by activating the sympathetic nervous system. This sympathetic activation promotes cutaneous vasostriction, tachycardia, brown adipose tissue thermogenesis. We'll get into that a little later. And neurons that cause shivering in skeletal muscle to generate heat. The escalation prevents the body from becoming hypothermic. Got all that? We'll be testing on that later. So this is what happens when cold water touches your skin, aka this cold shock response. But at the same time, the parasympathetic system is activated due to this diving response. And if you're much for social media, if you Google cold plunging, you'll see people talking about something called the mammalian diving response. And that's exactly what she's talking about here, that's associated with cold water immersion. Contrary to sympathetic nervous system, it lowers the heart rate and blood pressure. So I see a physiological conflict here. It's a problem. This could explain possibly what winter swimmers feel before and after this initial cold shock. Hyperventilation, super discomfort, but it gradually turns into normal breathing and a feeling of calm, and you're still in this frigid water. That's kind of the explanation as to why you would actually feel that. And also why it's so incredibly important to enter cold water in a methodical, correct way so that you don't perpetuate this cold shock and miss out on all the benefits that come with it. So essentially, you're getting that hydrostatic pressure caused by cold water immersion, stimulating baroreceptors, both arterial and cardiopulmonary, and this results in an inhibition of sympathetic nervous system and an increase in vagal tone. Again, your feeling of calmness after that massive wave of sensation ceases. As activation of this vagal nerve is not within our conscious control, and it's largely responsible for heart rate reduction, vasodilation, constriction of vessels, and immune system regulation, as well as inflammation. So cold water immersion results in bradycardia and ultimately a decrease in total peripheral resistance because it inhibits the constriction of vessels that are caused by the sympathetic nervous system. So Dr. Susanna Soberg, as you might have suspected, she's got quite a bit of research behind her. She has a PhD with primary focus in metabolism and has dedicated her career to the convergence of science and health together. Through comprehensive research, she's identified this optimal timing, heat and cold exposure. She just actually released a book at the beginning of this year called The Thermalist, which has not yet been translated from Danish into English, but it will be soon enough. She is multilingual as well. And I've actually been in contact with her a couple of times back and forth, and she assures me that the English version is coming soon. She's very, very nice. But essentially, this cold and heat exposure bestows health benefits, manifesting now in the widely adopted guidelines of 11 minutes of cold and 57 minutes per week of heat. That's a total combination per week, and we'll talk about what that's called in just a second. She's kind of coined a phrase. As the founder of the Soberg Institute, Thermalist Cure, globally recognized, so Dr. Soberg has set forth scientifically grounded protocols that transcend traditional therapy practices, as you can imagine. The next gentleman is a little bit further out in left field, but no less important. His name is actually Wim Hof, and he goes also by the nickname the Iceman, for very good reason, which we'll talk about here in a second. This Dutch extreme athlete got his nickname the Iceman by breaking a plethora of records that are related to cold exposure, including climbing Mount Kilimanjaro in shorts, running a half marathon above the Arctic Circle barefoot, and standing in a container while covered with ice for more than 112 minutes. It is possible he did do this stuff. He is perfectly fine today to tell the tale. Using cold, hard nature as his teacher, his extensive training has enabled him to learn to control his breathing, his heart rate, his blood circulation, and to withstand these extremes. So there's an amazing short documentary. It's about 30 minutes long or so on YouTube on this gentleman. I encourage you to watch it. He's a fascinating individual, and he really is, at this point in his career, all about prolonging and enhancing the science that's around cold, and for that matter, cold and heat therapy as well. He wants to bring it to people that are able to do it and to actually teach those who can then teach others, which is, I think, really important to pushing his message. So he's made it his mission to share what he's learned with the rest of the world. And in this, he's developed something called the Wim Hof method, which is just a combination of breathing, cold therapy, and commitment, essentially, that comes with a range of other benefits. Not only has he helped scientific understanding, but he's accomplished, like we talked about, these feats of human endurance that has given him 26 world records, more than 18 Guinness World Records, including some of the most memorable achievements, like I said, running a half marathon above the Arctic Circle, swimming underneath ice for 66 meters. This one was kind of interesting. I'm not sure, other than just the human accomplishment, hanging on one finger at an altitude of 2,000 meters, and then climbing some of the highest mountains in the world while wearing shorts. He did climb Everest. He did not summit in shorts, but he did make it to Base Camp 4 in minimal clothing and shorts as well, with no frostbite and no residual deficits, which is, again, there's an entire documentary on that as well alone and in his book. He did run a full marathon in the mid-desert without drinking at all for the full 26.2 miles. And then, of course, in a period of ice cubes. So why is just extreme, why is one individual with extreme feats important? Well, some of the science that we'll talk about in just a second proves that it's not necessarily him. He's not necessarily some, anomaly that can't be repeated. And we'll discuss why. He's got a very interesting part of his life that proves that that's not the case. So A lot of you may have heard, if you're big podcast listeners, of a gentleman named Dr. Andrew Huberman. He's got a podcast called the Huberman Lab. He's a PhD trained neuroscientist and tenured professor in the Department of Neurobiology at Stanford School of Medicine. He is, he has on wonderful different topical hosts as well, and has interviewed some of the top scientific minds concerning cold water therapy on his show as well, including Dr. Soberg, and has compiled an instructional list concerning the practice of cold therapy. So it kind of has four primary components: safety, cold temperature, energy and focus, and then mood and metabolism. In terms of safety, when it comes to the breathing aspect, and breathing aspects are incredibly important in cold water exposure, no deliberate hyperventilation of any kind should be performed in or around any body of water. And it's important to say that and specify that, because there have been mishaps since this form of therapy has been growing. There have been problems with that, people not understanding the instructions, and then some unfortunate accidents that have been reported as well with that. Start slow. I can't tell you the number of friends who have been interested, and I've talked to them about this, and then they get, some sort of tub and 80 pounds of ice, and all of a sudden the water's 33 degrees, and they get in, and 20 seconds later they say, nope, I'm done, not for me, never again. It's not the right way to start. There is no absolute answer when it comes to how cold. It's a personal preference. It is better to start warmer than it is super cold again. Work towards cold. Showers are a great way to start. The prevailing science, again from Dr. Soberg, cites a water temperature of 59 degrees Fahrenheit or less to achieve indicated benefits that we'll talk about in just a second. In terms of energy and focus, and this is one of the driving factors that keeps me going probably 5 to 6 days a week, including this morning at 4:30 before I got on a flight to come here. I did 5 minutes at 44 degrees. Deliberate cold exposure causes a significant release of epinephrine, norepinephrine, and also prolonged release of dopamine in the brain and body. The cold causes their levels to stay elevated for quite some time, and their ongoing effect after exposure is increase your level of energy and focus, and that can be applied to any sort of mental activities, i.e., when I'm in the OR, when I'm teaching, when I'm doing other activities that require high levels of focus. In terms of mood and metabolism, while it's not true of necessarily every stress, cold exposure causes a prolonged release of dopamine. What's interesting about this, it's kind of an off tangent here. If you're a social media person, or if you even Google cold plunging and go down the rabbit hole to look at all the links there, you'll hear numbers thrown around like dopamine increase is 250% over baseline, norepinephrine up to 500% over baseline. These numbers are based on studies from the European Journal of Physiology in the early 2000s. You'll also hear that cold water exposure, given the right temperature and the right amount of time, actually gives you a higher dopamine increase than cocaine. Again, based on real studies. These are animal studies. Obviously can't do human studies, at least legally, through cocaine usage, but animal studies that showed approximately 150 to 175% increase of dopamine over baseline with exposure to cocaine versus cold water exposure, which is approximately 250% over baseline. So in theory, you'll hear people putting a lot of social media information out that says, cold water exposure gives you more dopamine release than cocaine, and they're not wrong, but it's probably not sending the right message. Dopamine obviously is a powerful molecule capable of elevating mood and focus and attention and all sorts of goal-directed behavior. So that's why it, I think, caught my drive and my attention in terms of what we do in the operating room, which is of the utmost importance to follow, teamwork, directions, and know exactly what's happening in the field. So that 11 minutes of cold per week is summed up in something that was actually coined by Dr. Huberman when Dr. Soberg was on his podcast called the Soberg Principle. That's essentially the principle to enhance the metabolic effects of cold, force your body to reheat on its own, or as she calls it, end with cold. That is deliberate cold exposure for 11 minutes a week total, not in one session. Please don't start with that. But rather about 2 to 4, maybe 5 sessions or so a week, lasting anywhere from 1 minute to 5 minutes or so. Initially starting, 2 minutes is a great time. It's enough time to get that cold exposure, shock, have it wear off, and actually feel calm before you exit the water, which is the most important effect from that. In the short term, cold exposure increases metabolism as well, as the body has to burn calories to increase that core temperature. However, total calories burned from cold exposure are really not that significant. So anybody that may or may not tell you, again, if you're checking into this, hey, it's a great weight loss tool, not really, not by itself. The theory is there, but it's not gonna just burn calories and you get in cold water and get out skinny in a perfect world, right? But the conversion, however, is what's important of white fat, which is our energy storage, to beige or brown fat, which is very highly metabolically active. And that can be beneficial for allowing people to feel more comfortable in the cold. We call adaptation. Over time, you will have less of a massive cold shock if you do this. And then also triggering further and more sustained increases in metabolism. And that fact is important. We'll talk about that and how that's personally affected me over time in just a minute. So another interesting study put out in 2014 by Cox and others they studied the voluntary activation of sympathetic nervous system and the attenuation of the innate immune response in humans. And this is where we begin to extrapolate on some of the uses of cold water therapy. Through the use of the Wim Hof method, which again includes cold water exposure and breathing techniques, they aim to test if the results from the first study, which are going to be duplicated in this study on Wim Hof, could be reduced from a larger group. In this study, they injected 12 Wim Hof method practitioners with an endotoxin that stimulates the body's response to exposure to E. coli. The fascinating thing here was that the results showed that, like Wim Hof from his first exposure, they were able to control their sympathetic nervous system and immune response with an anti-inflammatory mediators approximately 200% higher, while pro-inflammatory mediators were 50% lower. And these were all compared to a control baseline that were injected with a placebo effect. So obviously, this is potentially important for conditions that are associated with excessive or persistent inflammation, especially autoimmune diseases, and why a lot of the research that's being conducted today are on arthritic conditions, other autoimmune diseases, and whether cold water therapy would be beneficial for those as well. So another interesting study I thought was researchers that checked the effects of cold exposure training and breathing exercise on the inflammatory response in humans. Again, kind of an extrapolation of what we were talking about in terms of inflammation. It elaborates on these raised questions from the 2014 study. This current research attempts to determine what kind of combination of the Wim Hof method elements are most effective in bringing down that inflammatory response, whether the presence of Wim Hof himself would actually affect the symptomology, and that's simply because this is the man who derived the method and he would be the best to teach it, and whether a short Wim Hof method explanation is comparable to a more intensive training, like climbing up a mountain in freezing temperatures or something of that nature. The results showed that a combination of practicing this breathing exercise and cold exposure is the most effective one in decreasing the inflammation in the body, this inflammatory response of the body as well, and alleviating symptoms. And that's rather than only practicing cold exposure or just the breathing exercise itself. And it also mentioned that immunological response is present regardless of who teaches it. And that's kind of Wim Hof's declaration that anybody can be taught how to teach this method as well as an independent instructor. Also, there was no difference in physiological effects that can be attributed to the length of training. Thus, the implication is that techniques can be taught in a very short time frame to individuals to then practice. So here's the twist. It just so happens that Wim Hof has a zygotic or monozygotic twin brother. So enter that idea of the early implications that he was just some sort of freak of nature. There's something different about him. He can do this because of X, Y, and Z. This is not normal. Nobody else can do this. However, with a study that examined the frequent cold exposure and brown fat and cold-induced thermogenesis, they tested lifestyle and frequent exposure to extreme cold and then cold-induced thermogenesis as well in the Iceman, as well as his brother, with a normal sedentary lifestyle. He's actually a trucker in the Netherlands at that time. So subject A being the Iceman and subject B being his brother were both studied during a mild cold exposure, approximately 13 degrees Celsius, and under thermoneutral conditions at 31 degrees Celsius. Subjects had comparable brown adipose tissue activity with the range previously observed in young adult men. The cold-induced thermogenesis was relatively high between both, very similar, but unlike during our previous cold exposure tests in young men, both subjects practiced a tumo-like breathing technique. Tumo breathing is a very old, very specific breathing technique that was perfected by monks and has been used for thousands of years to generate heat, and has actually been shown in demonstrations as well. If you're interested, a quick check on YouTube. reveal some fascinating videos. But essentially, this breathing technique involves a vigorous respiratory muscle activity, and then it was also confirmed by high FDG uptake in respiratory muscle to confirm. So the conclusion there was that there's no significant differences found between the two subjects, and that indicates that the lifestyle and the frequent exposure to extreme cold doesn't really affect that brown adipose tissue activity and the cold-induced thermogenesis. So they're brothers, they're the same. Even though Wim Hof does this and his brother does that, it reinforces the idea that anybody can learn and be adapted to practice this method and have the benefits as well. So I started my cold exposure in early summer 2022. Like I said, I began with showers, normal warm water, followed by 30 to 60 seconds of full cold water. I practiced slow, purposeful breathing during the cold portions of these showers, and it's important to mitigate that cold shock response. Again, that breath control is vital. It mitigates the shock, and if you don't mitigate the shock, then essentially you typically don't last very long. And that's when I've guided a lot of my friends in their first exposures to this, you can see the difference night and day as to whether somebody's able to follow the instructions for breathing or not. Lack of breath control, again, short tented breathing, quick inhalations, and incomplete exhalations. It exacerbates cold shock and often leads to the cessation of the entire situation. People get out and say, nope, never doing it again. So I do practice Wim Hof breathing and cold exposure techniques, but I firmly advocate, again, I have to say this, that these breathing techniques are never practiced in or around a body of water. Very important to say that. So in fall of 2022, I created a rule for myself. If the water is at 50 degrees, I'm in 5 minutes, 40 degrees, 4 minutes, and 30 degrees, 3 minutes. This follows all practical implications. This is more of an anecdotal recommendation for myself based on how I felt. But adding ice really became a bit of an issue. And I thought, wait a second, I'm a perfusionist. Why am I putting ice in every single time? This is getting expensive and laborious. So enter a device called an aquarium chiller. It's essentially an air conditioner for water. It's used for very specific types of species of fish. And enter a submersible pump, tubing, and a filter, and you have yourself a situation where you can keep the water at whatever temperature you want to year round. You don't have to add ice. So that's what the majority of systems eventually became. They're available on the market for much more money than you're going to expend to put it together yourself. They're anywhere from $2,000 to $5,000 now, and I still to date have not put in more than $1,000 on my tub at any given point. So this photo is from spring of 2022. This was just when I was beginning cold showers and thinking something needs to change. I was 295 pounds. I don't have a lot of photos for myself at that time. My health was fairly poor. I was pre-diabetic, borderline hypertensive. I had an average of 140s over 90s, and I even spiked sometimes in the 150s. My doctor told me it was time to start an antihypertensive while I continued to work on losing weight and improving my health. I asked for 3 more months, started taking cold showers. My diet remained inconsistent at that time, and my exercise was still pretty inconsistent, mostly walking, some sporadic weightlifting, nothing super consistent. So at my 3-month recheck, my blood pressure was 135 over 86. We checked it 4 times. I say he checked it twice. He checked it 4 times just to make sure there was consistency in there and said, okay, let's talk about this. All I could really say is that I was consistently doing an absolute regular basis cold water exposure at that time for showers, and I hadn't even begun full immersion at that point yet. I was doing minutes-long showers. So I thought, okay, let's do 3 more months. And at that point, I knew I'm going to start putting myself immersed totally in cold water. Started in the 50s after purchasing my 100-gallon Rubbermaid tub from Tractor Supply. Not sponsored by them. Trust me, if I was, I'd have all sorts of Tractor Supply hats and jackets on here. My cold water exposure routine was about 3 to 4 minutes per session and at least 4 times per week, more often 5 or 6 or so. I was a man on a mission at that point. At my checkup at 6 months, things were beginning to become a little more obvious. I had lost about 18 pounds without any other true diet or exercise change, if I'm being very honest here. Blood pressure was now consistently in the 120s over 70s, and I noticed a few other changes as well. I had a much higher increased physical drive, increased physical energy that facilitated the start of physical exercise program at that point that would yield great benefits for me, better mental clarity, better and more consistent sleep, and in the OR, better clarity, mood, focus. I even received comments from some of my surgeons how on top of it I seemed lately, which was usually followed by, that didn't mean you weren't really doing well before, but well, I gotta go. And then they just walk away. But I realized I wasn't performing at my full capacity before. I deserved better, and so did my patients. This led me on a path of slow, steady improvements that still continue today, still keeping an eye on that blood pressure. As of today, my most recent blood pressure is 109/67. On average, I'm on no antihypertensives of any kind. Oh, by the way, I've also lost over 50 pounds since that time. Approximately 30 points of systolic pressure have been reduced since my initial hypertensive measurements. I've also lost negative thoughts that were present in my mind. I'm not a runner. I never will be. But in the fall of 2023, I ran my first official race ever. I've never done a 5K. I've never done a 10K. And I ran a half marathon in 2 hours and 47 minutes. Because why not? People would tell you, no, you don't start with a half marathon. Why not? Why not? That's a negative thought. So in October this year, I'm doing a full marathon because why not? My results are my own, but the fundamentals of cold water therapy remain unchanged. And I can't tell you that that is exactly what has caused the increase and improvement in my life in general, but I can tell you that it's not. That makes any sense. Again, results are mostly anecdotal. The results and progress I've described are my own, but I can guarantee, and I can't really guarantee the same from one person to another. But what I can tell you is there is an increasing community that exists reporting improvements in mental health, psychological improvements, mood stabilizations, and even autoimmune improved response. Most of these are case studies, but there are ongoing studies and trials that are actually happening now. Again, another clinical trial here as a training program involving breathing exercises, cold exposure, meditation that attenuates inflammation and disease activity and axial spondyloarthritis. This is a proof of concept trial, but something that has had really promising results and could potentially turn into a full-fledged trial. Essentially, there was found a significant decrease in ESR levels as well as the actual CRP from the ASDAS upon this actual training program and the intervention group. Again, these findings weren't full-scale randomized controlled trials. And again, this is from cold water exposure and breathing exercises alone. I find that fascinating. So in short, should you try it? I think so. I'd say yes, absolutely. I do have to say, because it's very important, you should consult with your doctor before you start any cold routine water exposure, especially due to the effects of cold water shock. I'm not a physician, but with pre-existing health conditions, you should be evaluated prior to this commencement, especially in the presence of cardiovascular disease or hypertension, coagulation disorders, definitely potential for pregnancy, or for those trying to become pregnant. That goes for men as well, because with cold water therapy, there has been an actual shown study that sperm counts reduce quite a bit, as you can imagine, but for many different reasons. But otherwise, I would say try it. You know, there's a lot of information out there. Go in gently, gradually, but you will not regret it. Feel amazing.